Mess. Casey, how tall are you? How much do you weigh? See, how rude. I would never ask that, right? But could a bigger waistline lead to a smaller paycheck? We first told you about this yesterday. Here we go. Getting a lot of reactions. CVS, for example, requires its employees who use its health plan to submit their weight, body fat index, glucose levels, and other information about their body, or they'll face paying a monthly fine. That fine is $50 each month. That's $600 a year. The employees have until May 1st of next year to make a doctor's appointment and record all of their vitals and then show it to the bosses. Critics say this is discrimination. Well, joining us now is Dr. Anthony Wehbe and attorney Ken Rothweiler. Ken, let's start with you. Do you think, well, first of all, is it even legal to do this as a company?
Well, you know, different states have different laws, Mike, when it comes to employment. But when I first heard about this, my reaction was, are you kidding me? An employer is going to require employees to submit their body weight, their body fat. And, you know, and where's that information going to go? So it's going to go to the insurance company, the health insurance company. You know, what's that going to lead to, Mike? What that's going to lead to is you have lower premiums if you have people that are more fit. So what employers are then going to do is they're only going to hire the most fit among them, amongst us. So people are going to have to really then worry about, you know, if you have a condition that causes weight gain that maybe is not, that you can't really be blamed, maybe it's hereditary or for some other reason, you're now going to be subject to, you're not going to be hired by certain employers. I think it's ridiculous.
Well, doctor, your whole life now is dedicated to help people losing weight. What do you think of this?
Well, Mike, as you know, there is the healthcare epidemic with the rising costs of healthcare and the obesity epidemic, where it's predicted that within 15 years, the U.S. population, 50% of the U.S. population is going to be obese. So various companies have taken different approaches to this, and what CVS has done is create a system where they penalize you for not participating in this healthcare, this wellness program that they have. And what I've seen in my practice is that when you force people to participate or either take a medication or participate in a wellness program, you're really going to get a lot of backlash, and people are going to resent you, and your employees will resent you, and eventually this is going to backfire. And many companies have taken different approaches. You can create a different system where instead of penalizing people, you reward them for healthy behavior and make this a voluntary system, where CVS has gone the other way. And I think there's also a middle ground as well, where you can create a reward system on top of that also.
But you understand why the company is doing this. I mean, is this being that much overweight, is it as bad as smoking? So some companies say if you smoke, you can't be on our health plan.
Oh yeah, I mean, with 75% of healthcare costs now attributed to preventable disease, whether it's smoking, obesity, the majority of those preventable causes are actually from obesity. So it is truly an epidemic. I mean, I see this in my daily practice at the clinic and at the hospital, and that number has continued to rise.
Yeah.
So, I mean, it's a very...
Well, Ken, as an attorney, how's this going to play out?
Well, you know, I think, Mike, that the insurance companies, what they're trying to do is, this is just all about money for them. It has nothing to do with the health of the individual employees. I think if you're an employer out there, and if you want to help employees, I think what you should do is what we've done in our law firm. I mean, I'm an employer. What we do is we've offered our employees health club membership. What we try to do on different days during the week is we bring in breakfast and we bring in lunch that are healthy for the employees. We encourage people to walk during lunchtime. I mean, really, if you're an employer and you care about your employees' health, then do things proactively that help them.
Ken, wouldn't it be quite an incentive to say, listen, if you don't lose the weight and get healthy, I'm taking you off your benefits?
No, I think that's punitive. I think that treats people like children. I think you have to treat people like adults. And I think this goes to violating privacy rights as well, Mike. I mean, we have what's called HIPAA laws, Health Information Privacy Act, that these things violate. I mean, one of the biggest things you have in terms of your own privacy is your own health. You shouldn't be required to be mandated by your employer to give your body weight, your body fat, and all kinds of things concern your health. I think it's ridiculous.
And I think the CVS not the only ones trying this. I think the Michelin Tire Company, ironically, their mascot, I think, is this big bloated tire. I think they're going to try to do this too. So, doctor, if I work for CVS, I go, oh my gosh, this is going to be a law go into effect. What's the quickest way in your mind after all these years to lose weight and maybe do it quickly?
Correct. So what I think even Ken was mentioning, there's really educating people, whether it's giving them gym memberships or bringing them healthy food. It's truly about educating people and telling people what the right foods are to eat. And there's a lot of options out there, and it's not just about diet and exercise or calorie counting or prepackaged foods. You truly have to see the cause, the root cause as to why someone is gaining the weight, and create a system for them to address those root causes. And it's not a one-size-fits-all. And that's
Yeah.
what we do, is we really address the causes and we educate people. It's truly about educating what the right things to eat.
Well, a lot of food for thought there. Thank you both for coming in. Okay,
Thank you.
have a great
Thanks,
weekend.
Mike.
Thanks
Good
for
seeing
having
you.
us.
You know, the Target stores thought they had come up with a pretty clever name for